The Kenya Union Post-Primary Education Teachers Kuppet has issued a 7-day ultimatum to the Social Health Authority, SHA, to fix gaps in its health insurance system, saying the scheme is not working for teachers despite them being among the biggest contributors. The remarks come after officials of the union had to raise over 1 million shillings to help settle the medical bill of a teacher who was involved in an accident here in Nairobi. Let's get more from NTV's Susan Waweru.
They began with a warning.
We are therefore giving SHA a notice of 7 days to style up. Otherwise, we shall be calling our members to be on the streets because this thing cannot work.
The remarks come after Kuppet officials and other teachers had to raise over 1 million shillings to offset the medical bill of teacher Alex Ngare at Aga Khan University Hospital. Ngare is one of the teachers who was involved in an accident in January after being hit by a bus while leaving the union's elections held at City Primary School in Nairobi.
This is something we have never seen in the last 16 years. And therefore, SHA is not working for teachers. We are back to raising funds. And somebody should hear us. We are back to Harambe ili mwalimu atoke katika hospitali. Na tutakubali. Afadhali kama SHA hawezi kudhibiti medical cover ya walimu, basi wawachane nayo.
We have many teachers who are now held, especially those even who have passed on, who could not be treated because the cover is said to have lapsed. When a teacher has only stayed in hospital for 3 days, SHA says they cannot now proceed to pay.
According to the union, teachers contribute significant amounts to the scheme through statutory deductions as well as a managed medical scheme administered on their behalf by the employer, the Teachers Service Commission.
We don't want to go into the debate of fraud or whichever. Yeah. That one it should be catered for by the system that is being created. But if the system is already fatigued because they installed a very inferior technical equipment,
they say SHA has also failed to meet several commitments made to teachers.
SHA is not providing what is called last expense, which we used to have. Mwalimu alipokuwa anakufa, tulikuwa tunapata ile last expense. Na hiyo pesa ilikuwa inatoka baada ya 48 hours. Hawa SHA hawana hiyo kitu. Na walituahidi watakuwa nayo. SHA walituahidi watatupatia group life cover. There's no group life cover and nobody wants to address it. Even the CEO is not willing to address group life. Formerly, tulikuwa na full ex-gratia. Now ex-gratia is being paid at 50% and lazima utafute na torch. Hata sasa bado tunaitafuta kule Teacher Service Commission.
The other issues we'll be talking about with SHA is the accreditation of hospitals. We have said that hospitals in Nairobi alone are sending our teachers away like real. In fact, even over this accident, Guru Nanak did not admit those who are in accident. We have only 2 hospitals in Bungoma and only 3 hospitals in Kisumu.
The union insists if the situation continues as it is, it may be better to revert to the previous medical insurance scheme that was managed by Minet. However, in a statement, Cabinet Secretary for Health Eden Dwale says the Public Officers Medical Scheme Fund, which provides access to healthcare services for teachers and is administered under SHA, is not yet fully operational but is performing exceptionally well, ensuring the health needs for teachers are met without disruption. Dwale adds that more than 249,000 teachers and their dependents have so far been treated across the country, with claims currently standing at over 3.5 billion shillings. He further notes that teachers are now enjoying greater choice and access to healthcare services, saying that to date, educators have sought and received treatment in 2,823 different health facilities across the country. Susan Waweru, NTV.